A lot of people associate load management with elite level athletes. What I'd like to do in this next research vlog is talk you through how load management principles can be used with patients who are experiencing pain sensations and elite level athletes, and how the way we process that information is similar for athletes in pain and athletes who are experiencing fatigue. This is a paper that Kieran O'Sullivan, Peter O'Sullivan and myself wrote for British Journal of Sports Medicine, and it was entitled Pain and Fatigue in Sport, Are They So Different? And what we did with this paper was talked through how athletes and how patients process pain and process fatigue, and how we as clinicians can work with athletes and patients to get the best results for them. So when a patient or an athlete presents to us, they present with certain beliefs, and these beliefs generate a response, which also leads to an action, and every action has a consequence. And these beliefs, through to consequences, inform the way that we manage our athletes and manage our patients. So if we believe that the sensations that an athlete is feeling indicate an underlying danger to the body, then our response to that belief is to avoid those sensations of pain. It's a fear-driven avoidance. We tend to back off the training, or that vulnerable athlete will break. But when we go down that path, the consequence is that we're left with an athlete whose physical and psychological resilience is reduced. That we're left with an athlete who is vulnerable and deconditioned. But on the other end of the spectrum, we've all experienced coaches that are like a drill sergeant, where their beliefs around these sensations of pain and fatigue indicate a sign of psychological or physical weakness. Their response to that is to ignore the sensations and punish the athlete, to train them harder, to toughen them up. But the consequence of going down this path is that commonly it leads to exacerbations of sensations or tissue breakdown. But there's a third path that we can go down, and this is the path in the middle, where we acknowledge that these sensations of pain or these sensations of fatigue are driven by multiple factors or associated with multiple factors. The trick for us as practitioners is to acknowledge these sensations, work with our patients and athletes, and try and identify which factors underpin these sensations. If we can do that, we can educate the athlete and adjust the program so that the load that's maintained is the highest load that's tolerable for that particular athlete. And the consequence is we're left with an athlete whose physical and psychological resilience is enhanced. They're able to return to full capacity. So I'll ask you, if you're presented with these three scenarios, one scenario where you can go down the pathway on the left, where you believe that the sensations indicate an underlying danger to the body and it leads you to a deconditioned athlete. Or you go down the path on the right, where you see these sensations as a sign of physical or psychological weakness, but you end up with a broken athlete. Or you can go down the middle path, where you acknowledge that these sensations are associated with multiple factors and you're able to build that athlete back to robustness and resilience. Which path are you going to go down? To me, it's a no-brainer. We have to go down the middle path every time. We have to acknowledge that these sensations of pain can be driven by multiple factors, and that these factors can inform the way we manage our athletes. We're not dealing with robots, we're dealing with people, we're dealing with humans with emotions. If we can understand what makes them tick, it gives that athlete the best chance of training their way out of pain or training their way to peak performance. So hopefully you can see how this research can influence your day-to-day practice and how you interact with your patients and your athletes. Just because you have a patient in pain doesn't mean that they're injured. And equally, just because you have an athlete who's experiencing fatigue doesn't mean they're going to get injured. So if you've enjoyed today's vlog, make sure you leave a comment in the comment section below, or visit us at gabbittperformance.com. Thanks for listening.